Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 12th video of rapid revision course of Periodontics, which is very important for NLE, MDS, NBD as well as for BDS students. And this video is equally important in dental therapeutics, which included in NLE exam, which consists of mouth washes, because in chemical plaque control we will discuss about Chlorhexidine and Listerin mouthwash. And in our 11th video, we already discussed about mechanical plaque control, in which we discussed about toothbrushes and interdental aids and brushing techniques. But in today's video, we will discuss about chemical plaque control. Now, in chemical plaque control, using agent, that what are the mean in chemical plaque control, we use the agents. What are the function of this agent? Number one, minimize plaque accumulation, mean they minimize the plaque accumulation. Second function is disturb plaque making, they disturb the plaque making and easier the plaque removal. Third, work directly against specific microorganism causing caries and gingivitis, like triclosan reduce biofilm and gingivitis, 5% potassium nitrate reduce sensitivity, pyrophosphate salt reduce calculus formation, and foaming of toothpaste is caused by sodium lauryl sulfate. Remember, these chemicals are very important for MCQs exam, like triclosan reduce biofilm and gingivitis, 5% potassium nitrate reduce sensitivity, pyrophosphate salt reduce calculus formation, and foaming of toothpaste is caused by sodium lauryl sulfate. Alcohols in mouthwashes can interact with some medication. It also causes drying of the tissue, and be aware, do not use in a patient with xerostomia, which have already dry mouth. It worsens the condition. Now, the main MCQ's point is the substantivity. What is the substantivity? Substantivity actually is the persistent of effect of topically applied medication. Now, the best substantivity of Chlorhexidine mouthwash, which is remain for 8 to 12 hours, because it attach with the hard and soft tissue and slowly release, and its effect is for prolonged duration. This is the substantivity. Persistent of the effect of topically applied medication is called substantivity. Gold standard in mouthwashes is second generation. They have the highest substantivity. Mean in mouthwashes, the gold standard is the Chlorhexidine, because they have the highest substantivity, mean they have a prolonged release, slowly release effect. Now come to the commonly used mouthwashes. In commonly used mouthwashes, first is the Chlorhexidine. This is the Chlorhexidine. Now, Chlorhexidine is the gold standard anti-plaque or anti-gingivitis. If MCQs come, the gold standard mouthwash for is the anti-plaque or anti-gingivitis is the Chlorhexidine. Why? Because Chlorhexidine have antimicrobial and anti-gingivitis agent, because it is an antimicrobial and anti-gingivitis agent. Chlorhexidine is both bactericidal and bacteriostatic. It depends upon concentration. Now, in low concentration, it acts as a bacteriostatic, but in high concentration, it acts as a bactericidal. How its mechanism of action? Causes bacterial cell lysis, mean it lyses the cell, bind to the pellicle plus salivary protein and prevent biofilm formation. Because it bind to the pellicle plus salivary protein and prevent biofilm formation, plus bind to hard and soft tissue and then is slowly released from those sites. That's why it has high substantivity. If MCQs come, Why its high substantivity? Due to bind to hard and soft tissue, and its substantivity is from 8 to 12 hours. And chlorhexidine mouthwash is available as a varnish gel. Chlorhexidine is available as a varnish gel and mouthwash. Here there is a mouthwash. Now the recommended use of chlorhexidine. What are the uses of chlorhexidine? Before scaling and root planing, we use chlorhexidine to decrease bacterial load. Second, chlorhexidine are used in a high caries risk patient. Third, patient with a gingivitis, periodontitis, or after perio surgery. Fourth, in a immunocompromised patient. Now, how we use the procedure of use is actually after tooth brushing, after 30 to 45 minutes after tooth brushing, we use chlorhexidine and rinse with 10 ml for 1 minute twice a day for 2 weeks, but not more than 2 weeks, because it causes staining of teeth. And because why we use after 30 to 40 minutes? Because sodium lauryl sulfate in toothpaste deactivate the chlorhexidine. Now how we use? Rinse with a 10 ml per 1 minute twice daily for maximum of 2 weeks. Rinse 30 to 40 minutes after toothbrushing, because sodium lauryl sulfate in toothpaste deactivate chlorhexidine. Now come to the adverse effect of chlorhexidine are the oral mucosa desquamation, they remove the squamous layer, brown staining of teeth, and tongue aid restoration. Third is the temporary taste impairment, they change the taste, and increase supragingival calculus formation. These are the adverse effect of chlorhexidine. Now come to the second is the essential oil mouth rinses, which is the Listerin. This is the Listerin mouthwash, and Listerin is given in a dry mouth patient, but chlorhexidine is contraindicated in the dry mouth patient. Mainly the Listerin is Listerin is zero alcohol, and they are given in a dry mouth patient. Like here, the alcohol in mouthwashes interact with some medication and also drying of the tissue. Now in a dry mouth patient we give Listerin. Now come to the essential oil mouthwash, which is the Listerin. Reduce biofilm and gingivitis. Recommend for patient who cannot perform adequate oral hygiene with brushing and flossing. Second, use periodically to improve oral hygiene. Third, before scaling to decrease bacterial load. Now come to the adverse effect. It causes burning sensation, bitter taste, and staining. Fourth, the triclosan reduce biofilm, and quaternary ammonium compound reduce biofilm but little improvement for gingivitis, and same adverse effect as a chlorhexidine. In Listerin, the oxygenating agent 1.5% is the hydrogen peroxide, which causes bacterial cell lysis. Short-term use in case of pericoronitis and necrotizing ulcerative gingivitis. Prolonged use of 3% hydrogen peroxide causes gingival irritation plus delayed healing. And enzyme, which is biotin, for people with a dry mouth, we add this enzyme and contain lysosome and lactoperoxidase. This is the essential mouthwash Listerin. Increasing tooth brushing to 3 to 4 days time daily, not more effective in improving periodontal condition. If we normally we brush twice a day, if we brush 4 times a day, it does not improve periodontal condition. Ideal plaque control. How we ideally plaque control? because we already discussed about mechanical plaque control. Now if we ideally doing plaque control, it should be combination of mechanical plus chemical, mean toothbrush, mouthwashes, plus remove plaque retention areas like overhang or over contour restoration, rough restoration, construct better fitting denture, ortho treatment to realign malpositioned teeth, because there is a difficulty if teeth are malaligned. This is all about chemical plaque control, which is consist of chlorhexidine, which consists of mouthwashes, which is chlorhexidine and Listerin mouthwash. This is all about chemical plaque control. Now if you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.